Hey everyone, it's Rose and that's Cher, and today I'm going to be making a video talking to you guys about strokes, the symptoms, the risk factors, some treatment options, and answering some of your questions. So let's jump right into it. Alright guys, so I've talked about making this video for like the last couple weeks. There are so many things that I can talk about in regards to strokes. Like I could probably make multiple videos on it. There's just so much involved, you know, the human brain, like you can go in so many different tangents talking about the human brain. So I had put up a community tab post the other day asking like if anybody had specific questions so I could kind of narrow down what I talk about in this video. So I'm going to be answering some of those questions as well as just giving my own personal experiences of working with people that have had strokes, as well as just the general rundown of what a stroke is and all of that kind of stuff. So notes are ready. Let's jump into it. All right, so first question, what is a stroke? A stroke occurs when a blood vessel that carries oxygen and nutrients to the brain is either blocked by a clot or bursts. When that happens, part of the brain can't get the blood and oxygen it needs, which causes the brain cells to die. And strokes are actually the 5th leading cause of death in the world. It's important to note that it talks about the brain cells dying, and the faster that you can get the blood flow to return to that part of the brain, the more brain cells actually survive and the better that their outcomes are. I get into that a little bit later in the video or in my notes down here, but yeah, it's important that if you suspect that somebody is having a stroke to get them to the hospital as quickly as possible, because the sooner they're able to restore that blood flow to the brain, the better it's going to be, or the section of brain that isn't getting the blood flow, the better it's going to be for the patient. And there are actually studies out there that like even when parts of the brain, like on imaging, like MRIs and stuff like that, looks like it's not going to recover, there are times that it recovers. The human brain and the human body is kind of amazing in that fact that it bounces back relatively well. So anyway, important that you get someone to the hospital ASAP. So there are 2 types of strokes. There's an ischemic stroke, which is the obstruction of flow by a clot. So if there is a person out there that has like DVTs, which are deep vein thrombosis, like in your legs, there's also pulmonary embolisms in your lungs. If those travel through your bloodstream and get up to your brain, it can clog the artery in your brain and cause a stroke. The other kind of a stroke is a hemorrhagic stroke, which is just the rupturing of a blood vessel. Like all of a sudden the blood vessel just bursts. There's also a thing that is referred to as a TIA, or a transient ischemic attack. It's also known as a mini stroke. This is where the blood flow is blocked by a temporary clot. So this is like if a clot comes and blocks the vein for a little bit, but then it somehow gets dislodged and moves back through the bloodstream again so that the blood flow is restored. A lot of times with TIAs, people don't have a lot of residual effects, like they don't lose, function on one side for forever. It's like they have the symptoms momentarily and then hours, days, weeks later, they're gone. It's all kind of dependent on the person. That's another thing that I kind of want to bring up in this video, is that there's a lot of gray area here, especially when it comes to like the human brain and stuff. Everybody's going to be different. Everyone's recovery is going to be different. So that's something that's important to keep in mind. If a stroke occurs and blood flow can't reach the region that controls a particular body function, that part of the body won't work as it should. So if the blood flow is restricted to like the frontal lobe, that a lot of times affects a person's personality, their ability to control their emotions, things like that. But different things that are affected a lot of times by strokes are speech, motor control and muscle movements, vision, personality, coordination, memory, and their ability to swallow. Someone had specifically asked if strokes can cause blindness, if the occipital region of your brain is affected, or the part of the brain that controls your eye movement, or the nerve for your eye. I have never worked with anybody who's completely lost vision altogether in one eye, but a lot of times there's visual field cuts for people. So like they will lose all of their vision to the right in both eyes. So like, you picture a circle, this is your eye, all of the vision from here over is gone. So it's like black for both eyes. You can also lose it where the circle's here and you lose it cutting this way horizontally. I think it is possible for people to lose all of one eye, but I have never worked with somebody who has experienced that. So it's called hemianopsia, homogeneous hemianopsia, a bunch of big words, but there are visual field deficits if that part of the brain is affected. What are the risk factors for strokes? Being overweight or obese, physical inactivity, heavy or binge drinking, drug use, hypertension, smoking, high cholesterol, diabetes, obstructive sleep apnea, cardiovascular disease, which are any like heart diseases like AFib. AFib is a pretty common one that I saw in a lot of patients that I worked with that have had strokes. Personal or family history of stroke. So if you've already had a stroke, you're more likely to have another one, or if you have a family history of strokes, that increases your chances. Your age actually is a risk factor. So if you're 55 years or older, that puts you at a higher risk. For whatever reasons, African Americans are at a higher risk of having a stroke. Men are at a higher risk than women. The use of birth control or hormone pills that use estrogen also increase your risk of having a stroke. A lot of people had the question of, how do I prevent myself from having a stroke? The best way to prevent having a stroke is to change the risk factors that you have that are actually changeable. So if you're overweight, losing weight. If you aren't physically active, start being physically active. If you are a binge drinker, figure that out. Stop drinking. Don't use drugs. If you have high blood pressure, take your high blood pressure medicine, or, take the steps to lower your blood pressure. Cholesterol, if you have diabetes, take steps to lose weight, to start controlling your blood sugars a little better, all of that kind of stuff. So your way to prevent having a stroke is to just get healthier. So the earlier you can detect a stroke and seek medical attention, the better your outcomes will be. Typically, what I have been told is if you can get to the hospital and start treatment under an hour from the beginning of the symptoms, you're going to get the better outcomes. So if you notice somebody starting to have stroke symptoms at 3 in the afternoon, you want to get them to the hospital and initiate their treatment before 4 o'clock in the afternoon. So you have like an hour window to work with for the best outcomes. Something that was a big push a while ago that I haven't seen a ton of recently is they tell you to act fast. The acronym FAST, F standing for facial drooping. So these are symptoms that you should be looking out for in somebody. So if you notice like all of a sudden they're like, their lips are drooping down, or like their eyelid for whatever reason starts doing this, it's because they're losing the muscle function on one side of their brains or on one side of their face. So that's the one thing to look for. The second thing is arm weakness. So if you hold your arms out in front of you and one you can't hold up and it starts like drifting down, that's a sign of somebody having a stroke. Speech difficulty. So this is either you can't speak at all, your speech is slurred, or like you have trouble finding words. And the T stands for time to call 911, and also time just being very important. You want to get to the hospital in under 60 minutes. You don't want to be like, well, your face looks a little droopy, let's wait it out and see what happens. Like as soon as you notice that, get someone to the hospital. They're not, if you're not having a stroke, they're not going to slap you on the wrist for showing up to the ER potentially having a stroke. They're going to be glad that you got them there and able to run the test to make sure that they're getting the treatment that they need. Other warning signs for a stroke include sudden numbness or weakness of the face, arm, or leg, especially on one side of the body, sudden confusion, trouble speaking or understanding speech, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, loss of balance or coordination, and sudden severe headache with no known cause. It is important that if you have any of the risk factors for strokes that you follow your doctor's orders and take your medications as they are prescribed. So for example, if you have AFib, if you have hypertension, if you have diabetes, if you have high cholesterol, take all the medicines to help get those things under control. A lot of times people will come into the hospitals that have had strokes because they've stopped taking their blood thinner, for example. Like if someone is prone to like having clots and they stop taking their blood thinners, you can develop a clot and that can go up to the brain. People who have stopped taking their medicine for AFib, like those are the two that I can think of off the top of my head that I see a lot, is people just haven't been compliant with their medications and it causes them to have a stroke. One of the questions I got was why can't people who have had strokes drink water? My guess is what happened was someone went into the hospital and then they wanted a drink of water. They had a stroke. They wanted a drink of water. The nurse said, no, not yet. A lot of times after having a stroke, you need to be evaluated by a speech therapist. They're the ones who kind of determine your ability to swallow. So you have to pass a swallow test, which a lot of times starts as a bedside exam where they give you water, they give you different textures of food to see if you're able to swallow them without aspirating. A lot of times a sign of aspiration would be if someone started coughing. Aspirating means it doesn't go down like the right tube, it ends up in your lungs instead of down into your stomach, esophagus region. So that would be my guess. Sometimes it's called dysphagia when they aren't able to swallow and they aspirate their food. A lot of times people who have had strokes or other different conditions that cause problems with swallowing, they can thicken your liquids, they can change the texture of your food so that it makes it easier to swallow so that you don't aspirate or have it end up in your lungs. Because a lot of times if you aspirate and it ends up in your lungs, it causes pneumonia, which leads to much more problems. So that was one question that I wanted to answer while I was in here. So different stroke treatments the most rapid recovery happens in the first 3 to 4 months, but some survivors continue to recover and gain back function into the first and second year after their stroke. What I've always been told is that you get the most rapid gains and improvements in the first 6 months, and then after the first 6 months, the improvements start to slow down. So it's very important in the first 6 months to get as much therapy in as you can so that you can regain the function. Like if you have lost function on one side of your body, or if you have difficulty swallowing or the speech is a problem. There are so many things I can talk about, but as far as the speech is concerned, there's things called expressive aphasia, which means you try to talk and when you talk, you aren't saying the right words. Like it's just a bunch of gibberish, or you say like, instead of saying like, hi, how are you? You'd be like, hi, chicken vanilla garbage can. Like it's just literally, they say words, but it's not what they're trying to say. There's also receptive aphasia, I believe is what it's called, where if someone's talking to you, and you've had a stroke, you don't understand anything they're saying. It sounds like gibberish. I've also seen people who just don't talk at all. There's so many different degrees of strokes. There's so many different degrees of your loss of function, loss of abilities, depending on how bad the stroke was, what areas of the brain it affected. Sometimes you can have a stroke and it only affects one small area of the brain. Sometimes you can have a stroke and it affects a large area, or it affects multiple lobes in the brain. So there are so many different things that can happen. A lot of times if the stroke is on the right side of your brain, the left side of your body is the one that's affected. So like your left arm is weak, your left leg is weak. I believe that if you have the stroke in your cerebellum, which is the lower part of the brain, all the effects are on the same side of the brain. The brain is a very complicated thing that it's hard to learn. It was one of the hardest things I had to learn was neuroscience when I was in grad school. So it's hard to explain, it's hard to understand. But when you actually see it and you work with, like I've worked with so many stroke patients, that you start to kind of understand it a little better once you're able to apply it to real life and a real human. So, like I was saying, first 6 months are where you see the most rapid recovery. About 10% of stroke patients recover completely with no residual effects. 25% will suffer mild ongoing symptoms. So that could be anything like difficulty with the swallowing. So you have to change the texture of your food, the thickness of your food. That could be, you end up with foot drop, which is where on whatever side the stroke affected, like you can't pick up your toes, so you have to wear a brace on your foot. mild things that are kind of inconvenient but don't really affect how you go out into the world and are able to do things. 40% will be moderately impaired, and then 10% will require long-term care. So those are the people that aren't able to function in their house anymore with their family, so they need like skilled care from like nurses, therapists, all of that kind of stuff. So now I kind of want to talk about my experience with strokes and things like that. The reason I became a physical therapist is because my aunt had a stroke that affected her left side of her body. It was a pretty severe stroke. So she wasn't able to walk anymore, so she was in a wheelchair. Anyway, I would go to therapy with her, and it kind of is what piqued my interest in becoming a physical therapist from a very young age. I was in first grade, I believe, when she had her stroke. So there are different things that people can use to maximize their function, maximize their independence when they've had strokes. There are braces that you can put on your ankle to prevent foot drop, or help with the foot drop, which I talked about is where you can't, here's your leg, here's your foot, and when you walk, you kind of drag your toe if you've had a stroke and you have foot drop. So you have a brace that helps keep your toes up so you don't drag your toes or trip on your toes when you're walking. Obviously, you can use things like assistive devices like walkers, canes, quad canes, wheelchairs to help maximize your independence. There are different balance issues. I worked with a guy when I was doing outpatient therapy still who was relatively young and relatively stubborn and didn't want to use a walker, didn't want to use a cane. And sometimes as a physical therapist, you learn the personality of the person, and you know, like sometimes people just need tough love, or they need to be like, you have to be blunt and stern with them in order for them to listen. This guy was one of those guys because he was like relatively young, had been healthy prior to having the stroke, and he was like, I'll bring this cane in and use it when I'm in here, but I can tell you I will not use it at home. And I said, so when you come in and tell me that you fell at home, I'm going to tell you I told you so, is exactly what I told him. And then literally, I think it was 2 weeks later, he comes into the office and he was like, so I fell. And I was like, how'd that go? And then he told me about it, and he was like, and you're right, I need to be using the cane. So luckily for him, he didn't end up getting hurt. And I had talked about this in my last video where I reacted to Amy. Please don't be embarrassed to use an assistive device. It's what's going to keep you safe. It's what's going to keep you as independent as possible. Had he fallen and broken a hip, he would have been almost back to square one with recovery and learning how to walk and all of these things. The reason that balance made me think of that is because that's what I worked on a lot with him, was his balance and like relearning his center of gravity. For whatever reason, when people have had strokes, their balance can get messed up. It's a brain injury is another thing that's important to know. A stroke is a brain injury. So how many things can happen with a brain injury? A ton of different things. So that's something to keep in mind when people are asking me about, like, you know, why can't they talk? Why does their personality change? It's an injury to the brain. So whatever the brain is involved in, which is everything that a human does, all of that stuff can be affected. So anyway, back to the balance. If sometimes people who have stroke develop this thing called pusher syndrome, I believe, and I've only seen it in 1 or 2 stroke patients that I've treated, where their balance gets so far thrown off that they start pushing into you, because they don't realize that they're not balanced. Like, I'll be like holding them or helping them walk, and they'll just be pushing into me the whole time. So one thing that's important is to help a patient like relearn where their center is. A lot of times you stick a mirror in front of them so you can be like, look, you see, like you'll draw a line down the middle of the mirror and be like, look, you see how far over you are here? We got to get your nose lined up with that line in the middle of the mirror. Also, along with the vision changes and the balance issues, people develop this thing called right-sided neglect or left-sided neglect, whichever side of the body that's affected by the brain or by the stroke. So if the stroke is on the right side of your brain and you lose function on the left side, for whatever reason, in some people, because the brain isn't recognizing this left side of the body, they completely neglect it. They don't look at things over on that side. They're always looking at things on this side. If they're walking down the hallway, they'll be running into things on the left side, like bumping into the doors, bumping into like tables on the left side, and they don't even know. So it's important, like as a physical therapist, a lot of things you have to force people. You're like, what is over here? And you'll look and you make them like read signs in the hallway as you're walking down, and you make them focus on the left side. You bring up their hand so they can see their left hand because they don't recognize it as their own left hand. Also, I've seen strokes where people walk with a walker and that's all they need and they walk fine. I have seen strokes where people can't walk, can't talk, never regain function of the side of the body that was affected. So there's a wide variety. Like, you see people that are my age that have had a stroke that function completely normal, weren't affected at all by it. And then you'll see I've had very young people who have had strokes and they don't walk again, they don't talk again, they don't eat again, they have to have a peg tube put in, which is a tube that they give you like tube feedings, like directly into your stomach. So there's just a wide variety of like how severe the stroke can be and how severe your disabilities will be because of the stroke. I've also seen patients who have had craniotomies, which just means that they cut a portion of the skull out because of swelling that's happened in the brain to kind of help relieve that swelling. And people have to wear a helmet until they're able to reconnect that part of the skull. The vision loss, which I've talked about, the neglect I did talk about, and pushing I talked about. All right, so I know for a fact I didn't cover 25% of what goes into strokes. I just kind of wanted to give a quick rundown without making an hour-long video. I wanted to talk a little bit about my experience working with stroke patients. Stroke patients are the reason I am a therapist. I love working with them. I love being able to improve their function. There was a guy at my first job down here in Florida who I would go in. I was the only therapist he would work with. And like, I just remember the first day that we were able to walk, and I had him in the hallway on the rail, like there's a rail on the hallway wall, and he would hold on to that, and I sat in a stool on like next to him, and I had to advance his left foot for him because he had no control of that foot. But like, just watching him improve every day, he starts laying in a bed and we just practice standing or whatever it was, and to get to the point where we're out in the hallway walking, it's just amazing to see the progress that people make. And stroke patients are always near and dear to my heart because of my aunt. So it's a subject that is a touchy subject for me at times, but I'm glad that I am able to educate patients or people or families on this kind of debility or issue that is out there that's very, very common. And yeah, neck hives. If you guys have more questions, let me know down below. If I need to make a follow-up video, I will. There may have been things that I didn't explain well enough in this video, so I am willing to make another video kind of re-explaining things and going into more details about other things, whatever needs to happen. If you've made it this far, 25 minutes is how long I've been filming. If you've made it this far, thank you for watching. If you liked it, please give it a thumbs up. If you're interested in seeing more from me, please subscribe and hit the notification bell so you get notified when I upload. I always leave my Twitter and Instagram link down below, so you can follow me over there if you'd like. Thank you again for watching. Don't forget to wash your hands, and I will see you in the next one.